and welcome to my presentation on the efficacy of computerized attentional bias modification of e-cigarette use behaviors among transitional age youth, the beginnings of a cross-sectional study. My name is Alex Nelson. To begin, it's important we understand a few key terms. First, what is attentional bias? Attentional bias refers to the elevated attention to stimuli or cues with enhanced saliency, importantly relevance, for certain individuals or groups. For instance, nicotine products. Attentional bias assessment, like we do in this study, quantifies the unconscious or implicit processing of incentivizing, salient, drug-paired cues, which may provide a key index for addiction. For instance, repeated drug use stimulates the mesolimbic dopaminergic pathways, otherwise known as the reward system, which increase incentive, thus promoting attentional bias toward drug-associated cues, cravings, and other maladaptive use behaviors. These neuroadaptations can make affected individuals greatly susceptible to drug-related stimuli, thus posing market health risks. Further comparisons include individuals with anxiety disorders demonstrating an automatic attentional bias toward threatening cues in their environment, as well as drug users and addicts demonstrating an automatic attentional bias toward drug-related cues in their environments. Second, what is computerized attentional bias modification, or CABM? Otherwise known as attentional retraining or a form of applied cognitive processing therapy, CABM refers to computerized retraining of attentional biases where the participant is trained to adopt an implicit if-then rule, stating if both salient and neutral stimuli are present, then focus preferentially on the neutral stimuli. Previous psychopathologies have shown effectiveness in the attentional retraining of participants battling other maladaptive use behaviors, specifically modalities of addiction, like alcoholism, by reducing relapse rates at 1 year out up to 13%. Interestingly, computerized applications arose out of video game development in the 1970s. Now, what does CABM look like in action? Well, Figure 1 is an example of this computerized paradigm through a dot-probe task. Each trial is presented with a central fixation cross located here. Then 2 images appear, one salient, of a woman smoking, and one non-salient, of someone unrolling some tape. Third, a decision task is prompted, otherwise known as a probe. The duration of time utilized by the participant to make their decision, either rapidly or hesitantly, can be quantified as an implicit measure of attentional bias either toward or away from salient stimuli. In this case, the probe appears to be representing a neutral or non-salient image, like the tape, and would likely be quantifying the hesitancy of decision making. Now, this study specifically. Through the study, we aim to investigate the feasibility and effectiveness of a novel CABM program to promote disengagement from potent e-cigarette cues, intently targeting the adolescent and young adult or transitional age youth demographic. The detrimental health outcomes of chronic e-cigarette use are largely unknown, and there exists a critical lack of therapeutic options to address these pathological e-cigarette use behaviors among young adults. Moreover, evidence suggests that attentional bias modification relates strongly to changes in activation of the prefrontal cortex in response to emotional stimuli, thus promoting potential future disengagement from salient environmental cues. Key to this presentation specifically, this study was predicated on a prior concept analysis and pilot study on the impressionability of adolescents and young adults. Prior studies investigated the claim that environmental determinants are associated with youth health risk behaviors. This presentation will focus mostly on methodology and objectives of the future cross-sectional design, whereas data collection and analysis will begin this fall and feature a separate presentation. Research aims. Our research aims can be broken into 3 separate categories, first beginning with 1. 1A is the examination of whether CABM can reduce attentional bias toward e-cigarette cues, assessed through this well-established dot-probe task like we're familiar with in Figure 1. Aim 1B is the examination of whether CABM can reduce arousal or urges for e-cigarette cues, assessed through other psychophysiological reactivity indexes like this cue exposure task. Aim 1C is the examination of whether CABM can actually reduce the frequency of e-cigarette use. Aim 2 regards the examination of user acceptability of CABM, and Aim 3 is more of an exploration as to the attention to and perception of anti-e-cigarette information on online media. Methodology. Here's a brief overview. Participants will engage in a 5-part online program consisting of a pre-training assessment, 8 training sessions over a 1-month period, as well as progress surveys throughout the training sessions. These will consist of 40-minute assessments and 20 to 25-minute training sessions. These training sessions involve a 2-arm randomized division into an 8-session CABM training or placebo training over a 4-week period, via participants' own mobile device or laptop. Essentially, the meat and potatoes, if you will, of this study is to train participants to adopt this implicit if-then rule. This will consist of image pairing tasks similar to that in Figure 1. Now, assessments and surveys. Like we said before, this study will consist of numerous quantifying measures to ensure that this implicit if-then rule is being established and maintained. Such measures include a pre-training assessment, pre-training survey, progress surveys, post-training assessment, and a 3-month follow-up assessment. This pre-training survey is to gauge participants' demographic information, tobacco, marijuana, alcohol use habits, nicotine dependence, drug abuse, other psychological aspects like depression, anxiety, or stress, sleep, and even exposure to tobacco marketing, similar to AIM-3. Pre-training assessments now will consist of an attention task presenting salient, nicotine-based images promoting a participant's decision-making and then quantifying it, similar to Figure 1. Furthermore, progress surveys will consist of weekly questionnaires interspersed in the participants' training sessions and will target characteristics of e-cigarette use, nicotine dependence, and other psychological aspects like depression, anxiety, or stress. The post-training and 3-month follow-up assessments will be the same process as defined by the pre-training assessments. Importantly and key to this study, self-reported data gathered from pre, post, and 3-month follow-up assessments will be quantified and analyzed in order to gauge the effectiveness of intentional bias modification of participants using the CABM program compared to that of the placebo-controlled group. Essentially, this will gauge the study's overarching efficacy. This is all in accordance to our intervention plan. In Figure 2, this is an outline. Here we see we begin with the pre-training assessment, where we take a cohort of 50 participants and divide them randomly into 2 trials, either the CABM trial or the control trial. After assessments and training for 4 weeks, we have a follow-up at 3 months to gauge effectiveness. Now, what are our larger objectives? Well, our overarching objective is to record a statistically significant improvement in attentional bias in response to managing addictive impulses from salient, often potent environmental cues. This includes the adoption of this implicit if-then rule into the daily lives of participants, in essence necessitating a 3-month follow-up. Furthermore, we aim to publish a novel computerized attentional retraining protocol capable of modifying the attentional allocation of active young adult e-cigarette users away from said potent cues, allowing them the capacity to disengage from negative behaviors and live a healthier life. This is all in an effort to avoid the resounding concern that e-cigarette use may serve as a gateway to nicotine addiction, as well as other more deleterious modalities of addiction within a particularly vulnerable subset of the population. Using a push versus pull conceptual framework, we see CABM retraining participants to implicitly push away harmful nicotine stimuli and pull in benign, neutral stimuli. This is all in accordance with our transdisciplinary approach. As we can see in Figure 3, our overall vision is to optimize synergy through interdisciplinary collaboration. We see this collaboration from branches of nursing, psychology, and public health. And essentially, in the short term, we hope to gauge the feasibility of attentional bias intervention, whereas in the long term, we hope to apply the effective interventional approach in practice and reduce nicotine dependence and e-cigarette use among young adult demographic. Now, so what? Why should anyone care? Well, in 2018, 3.2% of U.S. adults reported current e-cigarette use, and in 2020, 19.6% of high school students and 4.7% of middle school students reported current e-cigarette use. E-cigarette use among transitional age youth, including within the Milwaukee area, is increasingly becoming a pervasive public health concern, lending itself to innumerable and emergent health maladies, for example, chemical pneumonitis. Aside from this resource's applicability to treating this emergent psychopathology, we believe in its precedential ability in the similarly emergent field of attentional bias modification as an addiction treatment protocol. Importantly, the prevalence of e-cigarette use behaviors and dire needs for effective prevention and intervention programs promoting public health, we believe, justify the overarching relevance of the study in modern healthcare. Such a protocol would enter the cohort of anxiety, addiction, and depression applied cognitive processing therapies as a novel interventional program actualized through the collaboration and utilized by disciplines of nursing, psychology, and public health. I would like to thank University of Wisconsin-Milwaukee's Office of Undergraduate Research for supporting the study, as well as my faculty advisor, Josh Gwon, and collaborator, Dr. Hanju Lee, as well as my undergraduate colleagues, Ms. Peyton Bendis and Mr. Stephen Shomish. Thank you and have a great rest of your day.